course, you cannot see shock, under the microscope, because shock is a generalized term. It's a combination of all. Okay? It's more of clinical. And number 2 goal is to visualize and apply the histopathologic patterns of the terms that I mentioned related to fluid and hemodynamic changes. Okay. So what are fluid and hemodynamic disorders? So ano yan, no? So it is a variety of basic disorders which result from inappropriate flow of blood or plasma through the vasculature. So in other words, imbalance. So imbalance of what? Of fluid in the body, usually excess, and imbalance also of blood and plasma, no, in our body system, no? So everything that is in excess is not good, no? So that's one of the essence of pathology here. Okay? And typically, this is not due to any single etiology, but are basic manifestations of diverse disease process. So ang isang term, hindi lang ibig sabihin yan na isa lang ang cause, no? It has a lot of causes. So these are just manifestations of diverse disease process, no? So these are manifestations. So ibig sabihin, these are the the lesions that you can see under the microscope. Okay? So what are the different fluid and hemodynamic derangements? So actually, I divided it into 3. No? So number 1 is the distribution of the abnormality of body fluids and blood. So this includes edema, congestion, and hemorrhage. While disorders related to the occlusion, occlusion of blood vessels are thrombosis, embolism, and infarction. And the disorders related to peripheral microcirculation are DIC and shock. No, DIC is disseminated intravascular coagulation. Okay, so as you can see here, I grouped this into 3, no? And we will discuss each one of the terms. But in actuality, they can occur together. No? Some may occur in combination or in all together. No? But for discussion purposes, we will discuss one by one. Okay, but understand that this can occur together. Okay? So let's start with edema. So ano ang sinasabing edema? Okay? So of course, it is an excess fluid volume in the human body. But where? But where? No? In the interstitial space. No? So as you recall in your physiology, we have what we call the 2 main compartments. No? Naalala pa ninyo sa physiology ninyo? Okay, so we have 2 important fluid compartments in the body. We have the intracellular fluid and we have the extracellular fluid. So common sense, no, pag intracellular within the cell, whereas extracellular outside the cell. Okay, so for outside the cells, there are 2 subtypes. We have the interstitial fluid, meaning outside the blood vessel, and we have the plasma or the intravascular fluid. So, ang edema, kung dumami ang interstitial fluid na yan. Are we clear? So, kung mag-excess ang interstitial fluid, that will result to edema. Okay? And intracellular fluid or intracellular fluid compartment, we have extracellular fluid compartment. Okay, the intracellular fluid constitute about 40% of the total body weight, whereas extracellular fluid constitute 20% of the total body fluid, because 60% of that is the total body weight of fluid in the human body. Okay? Then, aside from that, there is also a special compartment. No? It's called presence of ions and proteins. No? Then, your interstitial fluid constitute about 14%, while the intravascular fluid or plasma constitute about 5%. Okay? Then, the other fluid constitute about 1%. So this is called, this other compartment constituting about 1% is called the transcellular fluids. Okay? And the transcellular fluids includes your CSF, okay? Your cerebrospinal fluid, intraocular fluid, gastrointestinal secretions, pleural, pericardial, peritoneal, and synovial fluids. So remember, may mga laman yan, may mga fluid yan doon, and fluid in the urinary tract. So they constitute transcellular fluids. Okay? So there are points to consider. Okay? Number one, the distribution of water between the ICF and ECF compartments is determined by the distribution of electrolytes. So as of this time, ay alam ninyo ano ang mga electrolytes. No? For the ICF, it mainly consists of your potassium, magnesium, and phosphate. Whereas your ECF, we have your sodium, chloride, and bicarbonate. Okay? Another points to consider is the distribution of water within the extracellular fluid between the intravascular and interstitial space is determined by proteins. Okay? So there are two important considerations here, the electrolytes and the proteins. Okay. Next is fluid constantly moves between the compartments. So hindi sila steady, hindi yan stagnant. They need to move, no, from one compartment to another compartment. Okay? So kailangan mag-move on. So kung ano mga naiwan ninyo, every time kailangan mag-move on. So this is the normal, no, flow of fluid in the body. So first, the fluid leaves plasma at arteriolar ends of the capillaries. So because of the hydrostatic pressure. So lalabas yan, ang fluid na yan. Okay? Then the fluid there will go to the interstitial space. Then after to the interstitial space, the fluid will return to the plasma at the venular end. So we have the capillary end, we have the venular end. Okay? Because of the colloid osmotic pressure. Ang nagpapalabas is the hydrostatic pressure. Ang nagpapapasok ay colloid osmotic pressure. But not all fluid will go to the plasma or to the blood. Some will go to the lymphatic vessels. No? Again, through the hydrostatic pressure. Okay. Then, the interstitial fluid, balance yan. No? Balance yan kasi may transcellular fluid yan na may lumalabas din, tapos pumapasok din sila. And they are being used up by the intracellular fluid or in the intracellular cell. So, hindi ito dumadami. But anything, no? Any condition that can affect the hydrostatic pressure and the osmotic pressure as well as the transcellular fluid distribution here can cause problem in your interstitial fluid. So, kaya nagkakaroon ng edema. Okay? So, as I have mentioned, we have an arterial capillary end and we have the venous capillary end. So, lalabas dyan ang fluid kasamang oxygen and nutrients will go to the tissues. Then, the tissues will give off carbon dioxide and other metabolites will go to the venous capillary. Again, balik lang yan ang cycle. So, some will go to the lymphatics as I mentioned in the previous slide. Okay? Then, edema is nothing else but too much fluid. Fluid, ano namang klaseng fluid yan? So, ang fluid na nag-accumulate in the interstitial space. But what are those types of fluid? No? So we have two types. The fluid can be a transudate or an exudate. No? So when you say transudate, little protein and red blood cells. So this is an ultrafiltrate of plasma fluid. So this is due to the changes in the pressure. No, meaning increased hydrostatic pressure and decreased oncotic pressure. So there will be obstruction of the interstitial fluid drainage. Okay? Then this one causes increased tissue hydration. Okay? Whereas exudate is rich in protein and cells. Okay? So this is the typical fluid present in the inflammation. So that's why kung may mga infection tayo, no? May mga abscess, may mga boil, parang mayroong fluid, no? Or any types of inflammation. And this accounts for the tissue swelling. Well, exudate is due to the increased permeability of the blood vessels and hydrodynamic changes in the peripheral circulation. Okay. So we have the following terminologies. We have hydrothorax, hydroperitoneum, hydropericardium, and anasarca. No? So hydro means water. No? Hydro. Then thorax, of course, there is accumulation of water in the thorax. This is also known as pleural effusion. Hydroperitoneum, accumulation of fluid in the peritoneal cavity. This is also known as ascites, no? Ascites or peritoneal effusion. Okay? Then we have hydropericardium, accumulation of fluid in the pericardial sac, pericardial space. So this is also known as pericardial effusion. Okay? So when you say anasarca, it's a generalized term for edema. No? Generalized edema. Meaning, lahat ng parts ng body na mamaga. No? It's called anasarca. Okay. The classification of edema, no, according to the range that edema fluid spreads. No? It can be anasarca or it can be a local edema. Then edema is also classified according to the cause. It can be renal, it can be hepatic, it can be cardiac, malnutrition, or lymphedema. Then we have what we call inflammatory versus non-inflammatory edema. No? Inflammatory, this will be discussed when you go to the inflammation. Okay? For the non-inflammatory edema, this is due to increased hydrostatic pressure. So always remember, may dalawang pressure yan, no? The hydrostatic pressure and the oncotic pressure. Okay. Ang hydrostatic ang nagpapalabas, oncotic ang nagpapapasok. So if there will be an increased hydrostatic pressure, maraming lumalabas, no? Kulang ang pumapasok. Whereas kung decreased plasma oncotic pressure, na stagnant kasi hindi makapasok ang fluid within the blood vessels, no? Whereas lymphatic obstruction is a common sense. No? It's an obstruction of the lymph vessels, as well as sodium retention. It can cause non-inflammatory edema. I assume that you already know, no, the physiology, the normal physiology if you have a sodium retention. Okay. How about localized versus systemic edema? Okay. When you say localized, no, it can be caused by inflammation, no, because of the increased blood flow due to the arteriolar vasodilation and increased leakiness of your capillary endothelium. The localized edema can be also due to mechanical, meaning blockage of lymphatic vessels. Any condition which can cause blockage of the lymphatics, no? Special mention to the parasitic, no? The filariasis, the neoplasia, the tumor, no? And the chemotherapy or radiotherapy damage to the lymphatics, which can cause obstruction. Okay? So as you can see, no? These are what we call the cardinal signs of inflammation. Cardinal signs of inflammation includes heat, the calor, redness, no? as well as the redness, and swelling is the tumor. We have the tenderness and pain. So as you can see here, mayroong swelling. So may swelling because may inflammation man. So the inflammation and the edema in the inflammation is due to increased permeability. Then a fluid release into the tissue. Kaya mayroon kang edema or swelling in the inflammation. Okay. So this is an example of a localized edema. No? Mechanical. Due to the blockage of a lymphatic vessel. So this is filariasis. No? Tingnan niyo, malaki masyado ang kanyang mga paa. No? So because of the obstruction of the parasites in the lymphatic vessels. Okay. How about systemic edema? Okay, the systemic edema can be caused by increased hydrostatic pressure, reduced osmotic pressure, and sodium or water retention. And there are many causes of increased hydrostatic pressure as well as reduced osmotic pressure. Okay, so this is a pathway to your systemic edema. This is found in your book. So please read in details. No? Paano ang heart failure nakaka-cause ng edema? No? Paano ang sodium retention makaka-cause ng edema? Paano ang malnutrition nakaka-cause ng edema? Okay? So these are examples of systemic edema. Okay, continuation. So how about the sites? No? Although any organ or tissue in the body may be involved, edema is most commonly encountered in the subcutaneous tissues, no? In the lungs, as well as in the brain. No? So those organ na medyo malambot. Okay? So how about edema in congestive heart failure? So heart failure can be divided into right-sided and left-sided heart failure. So if you have right-sided heart failure, the right atrial pressure increases, as well as the systemic venous pressure also increases. So kung may right-sided heart failure yan, magko-congest, no? Congestion where? No? Systemic ang congestion. Kaya if you have right-sided heart failure, bumabalik ang water, no? So you have a lower extremity edema. So if you find patients in your history and physical examination, lower extremity edema, please check kung may problem ang right-sided heart niyan, no? Or it can manifest as a right-sided heart failure. So because this is systemic, bumabalik man doon sa system, no? So the liver will also react, no, by form of a centrilobular liver congestion. Okay, so this is an example of lower extremity edema, no? So of course there are many causes of lower extremity edemas, but you have to check kung may right-sided heart failure ang pasyente. Okay, and this is the compensation sa liver na nangyayari. It's called nutmeg liver. So we'll discuss that later when we go to the congestion. Okay? So edema in congestive heart failure kung left-sided naman. So kung left-sided, the left atrial pressure of course increases, while as well as your pulmonary venous pressure also increases. So where is now the congestion? So the congestion, left heart man. So, bumabalik siya patungo sa lungs, no? So, there will be a pulmonary edema. So, kung right-sided, you can have a systemic, no? And a lower extremity. Whereas, kung left-sided, this will go to the lungs, no? So, pulmonary edema. Okay? So, how will you know? Paano nalalaman ang pulmonary edema? So, when you examine the lungs, syempre, may laman ng tubig yan. So typically, this is 2 to 3 times normal in weight. So if you examine cross-sectionally, it will be fruity and sometimes blood-tinged fluid. And because of the presence of fluid, it may interfere with pulmonary function. Okay, so remember, this is the normal histology of the lungs. No? So you can see an alveolus, 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 and so on. and they are lined by different alveolar cells here. So paano natin malalaman kung may edema, kung may laman? Remember, these are filled with air. Diba? Air dapat yan, kaya clear. Hindi mo naman makikita ang air, so clear yan. Okay. But kung may edema, you can see something inside. No? So again, hindi rin natin makikita ang water. No? But under the microscope, you can see the alveolus, the lumen of the some of the alveolus here are filled with pinkish material. No? Dapat kasi ganito yan, walang laman. Dapat white lang, no? Kasi air man. So because of the presence of water, so mayroon siyang pinkish amorphous material. So ibig sabihin, So ibig sabihin may laman yan. There is something there, no, in the alveolus. So this is the microscopic picture of a pulmonary edema. Okay? So another picture, yan, no? So you can see some are the alveoli are already destroyed, no? Some are clear, so clear pa, while some are filled with this pinkish homogeneous amorphous material which represents water, no? Kasi hindi man natin makikita ang water. So some nagti-take up, no? So ibig sabihin may laman siya. So this is a picture showing you a pulmonary edema. Okay? So how about cerebral, no? Accumulation of fluid in the brain, no? So grossly, the surface of the brain with edema demonstrate widened gyri and some with flattened sulci. Okay? With flattened surface and the sulci are narrowed, no? Kasi mayroon ng laman, no? May water nga, may fluid nga. Okay? So this is the normal. As you can see dito, parang mayroong in between, no? Mayroon siyang laman in between. So this is a picture of a cerebral edema or a brain edema. Then we have the concept of the Monro-Keeley hypothesis, which states that the cranial compartment is incompressible and the volume inside the cranium is a fixed volume. So therefore, any increase in the volume of one of the cranial constituents, so including water, must be compensated by a decrease in the volume of another. No? This is a Monro-Keeley hypothesis. So ano naman ang clinical importance ng edema? No? So ano-ano ang importansya niya? So the effects of edema may range from merely annoying to fatal. No? In the subcutaneous tissue, it may signify cardiac or renal failure. So check with your patient, no? When you have later on in your history and physical examination, syempre namamaga yan. So there is something. There is something. So baka yan cardiac in origin or renal in origin. So that's one of the clinical importance. It is a manifestation of either a cardiac or a renal problem. Then what is the clinical significance of pulmonary edema? No? So it can cause death, no, by interfering with the normal ventilatory function. Okay? Then brain edema is very serious, no? It can cause herniation and cause also death. So that's the importance of edema. Okay? So next to edema, we will tackle congestion and hemorrhage. Okay. So alterations in blood flow and perfusion includes stasis. So stasis meaning andyan lang sila, no? Static. So when you have stasis of blood, it can result in congestion. Okay? And hyperemia. So, if you have a local increase of blood, kanina puro fluid, tubig ang pinag-uusapan natin, no? Now will be talking of the blood. So local increase in blood within a tissue can cause hyperemia, can cause congestion. Okay? So meaning stagnation of the blood in a certain organ or tissue can cause hyperemia or congestion. So when you say hyperemia, this is an excess of blood within blood vessels due to active process. Whereas congestion, this is also known as active hyperemia or erythema. Whereas congestion is an excess of blood within blood vessels due to passive process. So this is also known as passive hyperemia. Okay? And the hyperemia is due to arteriolar dilatation, whereas congestion is due to impaired outflow. Are we clear? So hyperemia is mga arterioles nag-dilate. No? Kasi active process man yan, active process. So there will be excess of blood within that blood vessels. No? Whereas congestion, hindi makamove, no? Hindi siya makamove. Kasi may bara or what. So that will be a term called congestion. So remember, we have an arteriole here, arteriolar end. We have the venular end. Okay? Arteriolar end is medyo mapula yan, oxygenated, whereas the venular end medyo lighter blue. So this is normal. But if you have hyperemia, meaning increased blood flow, no, you have an increased blood flow because of the arteriolar, lumaki man, no? Arteriolar dilatation. So lumaki ang arterioles mo. Siyempre kung malaki yan, malaki ang space, there will be ample time for the blood to go in. At maraming papasok na mga red blood cells or blood. Kaya dumami ang red. So as you can see, you have here a hyperemia or active process or erythema compared to your venular. Whereas in congestion, hindi makalabas, no? Hindi makalabas ang blood dito because of the impaired outflow, no? Impaired outflow. So since hindi makalabas ang blood dito, dumami ang blue, no? Dumami ang venular end na blood. So this is termed venous or congestion or cyanosis or hypoxia. No? Kasi less oxygen man, hindi siya makalabas. So this is termed congestion. Okay? So let's start first with hyperemia. As we have said, this is also known as erythema or active hyperemia. Okay? So we have what we call a physiologic hyperemia. So normal, no? If you have high blood flow to stomach and intestines during digestion. Okay? High blood flow in the muscles during exercise. No, kaya, di ba, after exercise, medyo mapula-pula. No? Mapula-pula ka. No? High blood flow in the skin to dissipate heat. No? Kung may fever, no? Kung medyo may fever ka, medyo mapula-pula ang pasyente. No? If you have high neurovascular hyperemia or blushing, nag-blush ka, no? Nakita mo ang crush mo, dumaan ang crush mo, pinansin ka, then medyo register sa brain kasi nakita ka ng crush mo, nag-blush. So it's a form of active hyperemia. Okay? Then, we have what we call a pathologic hyperemia. So ang pathologic hyperemia naman is the result of underlying pathologic process. So usually inflammation, no? The arteriolar dilatation is in response to inflammatory stimuli, no? So nagro-respond sila, so usually the pathologic hyperemia is seen in inflammation. That's why mapula, no? Pag may inflammation, there's a red coloration, no? Which is a cardinal sign of inflammation or a rubor, no? Redness. There's a hyperemia of inflammation. Okay? So what are the effects? Ano naman ngayon kung may hyperemia ka? No? So additional oxygen and nutrients to the affected part. No, maganda kasi marami ang oxygen. It can help also the removal of waste materials. And if there are harmful substances, it can be diluted kasi marami mang blood. Then, if you are hyperemic, maganda rin, no? Kasi additional white blood cells and antibodies to that area. Kaya, in inflammation, Pag nagre-red sila, ibig sabihin maganda na malapit nang mag-heal yan. No, kasi marami na yung WBC, marami ng antibodies, then marami ng oxygenation to that area. Okay? So how about congestion? So hindi makalabas ang blood. So congested. So examples of this, no, when you put a tourniquet or bandage prolonged time, no? So prolonged tourniquet and bandage application. So di ba napapansin natin pag matagal yan, medyo nangingitim na, di ba? Nangingitim na. So try to tie, no? To tie your arms, no? There's a part there na mangingitim na siya. No, kasi hindi nga makalabas ang blood. And also the pressure induced by tumor, enlarged lymph node and abscess, no? And for those with intestinal obstruction, strangulation and torsion, no? And for those with venous thrombosis. Okay? So what happened? So if you have left-sided heart failure, ano ang sabi natin kanina kung left-sided? So babalik ang fluid, babalik ang blood to the saan? So there will be back pressure where?
Lungs.
Okay, sa lungs, di ba? So pupunta siya sa lungs. So kung babalik ang blood doon sa lungs, there will be a stagnation of the red blood cells in the lungs. Kung water man yon, there will be accumulation of water, no? Kung blood naman yon, there will be stagnation of the blood in the lungs, so there will be a chronic passive congestion. So there will be a congestion in the lungs, no? Kung blood ang babalik. Kung water naman ang babalik, of course there will be a pulmonary edema. Okay? So how about right-sided? So kung right-sided, magba-back pressure din yan. Saan? Systemic, di ba? Systemic congestion. So kung systemic, any part of usually liver, then down, no, organs. So liver, the spleen, and the kidney. So there will be a congestion in the liver, in the spleen, in the kidney. Okay? So if you have a heart problem, no? Pag mag-left-sided na yan, pwede ang tubig ang bumalik, pwede ang blood ang bumalik. Same also as in the right side. Okay? So let's look at now, anong itsura ng passive congestion of the lungs? So kanina we discussed in edema kung ang tubig ang babalik. Ngayon naman kung ang blood ang magbaback pressure. So syempre kung maraming blood ang babalik to the lungs will be heavy and firm. Diba? As you can see in this gross picture. No? Then as you can see, the cut surface of the lungs is rusty brown. No? This is called a brown induration. Brown induration. Kasi maraming ang blood. No? Nasobrahan siya ng blood. Okay. Again, to give you a normal histology of the lungs, so ganyan ang itsura dapat. So walang laman, then okay ang mga alveoli. No? How about kung may congestion? No? So kung may congestion na in the lungs, look at the blood vessels in the alveoli, in the linings of the alveoli. No? So the typical picture of acute pulmonary edema is congested alveolar vessels with transudate inside the alveoli. So if you look at the lining, no, the lining cells here, dumami ang mga red blood cells. No, remember may mga blood vessels diyan. So compared dito sa normal, di ba wala namang mga red blood cells, no? So if we get closer view, normally may mga maliliit yan na blood vessels dito. But if there is congestion, dumami, no, kasi di ba may back pressure. So dumami ang mga red blood cells diyan. So this is a congestion. So sometimes it is coupled with pulmonary edema. As you can see in the alveoli, no, may mga laman. So congestion with pulmonary edema ito. So where's the congestion here? No, yan. Mga red blood cells in the septum or the septa of the alveolar, no, in the walls of the alveolar. Kasi it's supposed to be walang mga red blood cells dyan. Kaunti lang for the blood vessels. Okay? So closer view, no, of the lungs, no? Yan, dumami, no, dumami. Ang iba kumapal ang walls because dumami ang mga red blood cells, no? So thickened alveolar septae. Then because of the hemorrhage, no, because of blood, no, going back to the lungs, there will be rupture of dilated and congested capillaries. So, syempre, may mga foreign substances na dyan. There will be presence of macrophages, no? Ang macrophages ay pupunta na dyan. So, there will be a brown pigment that they have to ingest. No? Ingest kasi nila. The brown pigments na yan ay mga hemosiderin. No? Mga hemosiderin pigment cells. Kasi may rupture man dito. So may rupture ng red blood cells, maraming nag-rupture ng mga red blood cells. So may mga hemosiderin products. So they will have to engulf that. So forming hemosiderin-laden macrophages. Or these are called, when they are present in the lungs, are called heart failure cells. No? These are heart failure cells. So these brown cells here are heart failure. Actually, these are alveolar macrophages that engulf brown hemosiderin pigment. So because of congestion, so they form this type of cells. So these are called heart failure cells. No? So how about in the right-sided? Pag bumalik naman ang blood into the system, no? Of course, you have liver. So sa liver naman, imagine mo ang liver, dumami na naman pumunta ang blood doon. So anong nangyayari? So there is an alternating dark and red and white. No? There will be a dark, white, dark, white, dark, white, dark, white. Until it produces what we call a nutmeg appearance. No? Nakakita na ba kayo ng nut? It's not commonly found here in our country, no? But a nutmeg appearance. So you can see a liver. This is a congested liver known as a nutmeg appearance, no? The red ones are the red blood cells. The white ones are the normal liver parenchyma. Okay? So again, ito ang nutmeg appearance of the liver because of the congestion, no? Red, white, red, white, red, white, red, white, and so on. So this is a chronic passive congestion of the liver due to the back pressure into the systemic circulation. Okay? So yan, acute hepatic congestion, you can see here dilated blood vessels full with red blood cells. Okay? Then same as that, no? Liver. So about sa spleen, no? Sa spleen, ganun din, no? They will form, marami ring red blood cells doon because of congestion. So there will be dilated and engorged sinusoids in what part? In the red pulp, no? In the red pulp. So in the white pulp, so they will become hyperplastic. The white pulp are the blue ones, no? Then will become atrophic later on. Then, if there is a hemorrhage, kung dadami na itong mga red pulp na to, there will be a formation of fibrosideretic nodules. So itong mga brown-brown na to or blue-blue na to, these are called the gamma-Gandhi nodules. No? This is seen in the spleen due to chronic passive congestion. No? So gamma-Gandhi nodules, no? The seen in the spleen. Okay, so we are done with the edema, congestion. So let's go now to the hemorrhage. No? So common sense, what is an hemorrhage? So extravasation of red blood cells secondary to blood vessel rupture. So anong pagkakaiba niya sa congestion? So in the hemorrhage, nakalabas na mga red blood cells. So there will be extravasation. Whereas congestion, they are confined within the blood vessels. Okay. The types of hemorrhage are classified as to site, no? And as to size. Site and size. As to site, of course, location. If this is found in the thorax, it's called hemothorax. pericardium, hemopericardium. In peritoneum, hemoperitoneum. In the joints, hemarthrosis. So pag blood, hemo. Pag water, hydro. Okay, this terminology. Then the types of hemorrhage according to size. So if it is 1 to 2 millimeters, it's called petechia or petechiae. No? If more than 3 mm, it's called purpura. Then if this is more than 1 to 2 cm, it is called ecchymosis. Then a large pools of blood is called hematoma. So the description in your physical examination and your history PE, the size of the hemorrhage, may mga terminology yan. No? It depends upon the size. Okay. So what's the pathogenesis of hemorrhage? Of course, trauma. No? May laceration, syempre, mag-rupture ang blood vessels. No? Atherosclerosis, no, can cause hemorrhage. Why? No, because the atheroma, no, the deposition of fats, no, is within the blood vessels, di ba? So in the mucosa of your blood vessels or the tunica intima. So pag lumalaki na ang mga atherosclerosis mo or the plaques, atherosclerotic plaque, syempre it can cause, no, obstruction of the blood vessels, then later on it will rupture. So hemorrhage. Inflammation, no? If the inflammation is severe and it can affect your blood vessels, so it can cause rupture of your blood vessels, then there will be hemorrhage. No? Neoplastic erosion, no? If the tumor can go inside the blood vessels. No, pag madami ang tumor or malaki ang tumor, it can cause rupture. So this can cause hemorrhage. Then hemorrhagic diathesis, no? So if you have leukemias and any other abnormalities, no, in the blood, so it can cause hemorrhage. Okay? So what are the clinical significance of hemorrhage? Of course, if you have severe blood loss, no, amount of blood, increased amount of blood loss, you can have a hypovolemic shock. Then if you have bleeding into vital organs like the brain, the lungs, and the heart, this can cause cardiac tamponade. No? Then if you have external blood loss, it can cause iron deficiency anemia. And if you have internal blood loss, you can have jaundice. So these are the clinical significance of hemorrhage. No? Of course, this is a brain with hemorrhage. So take note with the circle of Willis. No? Kasi di ba malalaking blood vessels yan. So a branchial rupture can cause cerebral hemorrhage or subarachnoid hemorrhage. So this is also a lungs, no, pulmonary hemorrhage. Hindi mo na makikita ang mga alveoli, no, because they are covered now with blood, no. There's a hemorrhagic necrosis. Okay, so we are done with edema, congestion, and hemorrhage. We should go to the second classification, no, in the occlusion of blood vessels, no. Kung nababara na ang mga blood vessels. So under this, we have thrombosis, embolism, and infarction. So what is thrombosis? So thrombus, no? So solid clotted mass is called a thrombus. So pag marami ng mga blood vessels na caused by thrombus, it's called now thrombosis. So it is made up of blood elements. So you can kailangan mayroong blood vessels, mayroong platelets, and clotting factors. Usually the thrombus are intravascular. And normally may thrombosis in a living person. It's called antemortem clot. We have to differentiate that from a postmortem clot, which is formed extravascularly. And postmortem because there is clotting after death. And it only involves the clotting factors. So grossly, these are rubbery, gelatinous, and they form perfect cast on the vessel wall. And take note, there is no attachment to vascular endothelium. And grossly, they are current jelly or check-in fat clot ang tawag sa kanila. Okay? What's the difference between thrombosis and hemostasis? Anyone? Anyone from the group?
Thrombosis, Doc, is a result of failure in hemostasis, Doc.
And what is hemostasis?
Balance of parang normal blood with respect to the platelets, coagulation factors, chuchu, and others.
Okay, so very good. No? So, when you have imbalance na, magkaka-thrombosis ka na. No? Hemostasis is a normal process. No? So, this can also be a double sword, no? Hemostasis mo. Pag hyperactive yan, delikado din. No? So, there is a sequence of events in hemostasis. No? So, these are the 4 important sequence of events in hemostasis. The first event is vasoconstriction, which can help to deliver all the nutrients or the necessary molecules or ingredients needed to produce a primary hemostatic plug. Okay? So since primary hemostatic plug is not strong enough, so kailangan mag-form ng secondary hemostatic plug. Okay? And there will be thrombosis and anti-thrombotic events. No? So thrombosis also is a double sword. So normally, may nagtuthrombose tayo, but it is replaced. No? Kailangan kaagad yan ma-relieve, no? Para hindi mag-over. Hindi siya mag-over by anti-thrombotic agents present normally in our body. Okay? Kasi kung hindi mag-thrombose, hindi yan mabubuo. Hindi mabubuo kung, for example, may sugat ka, no? So, hindi yan mas-healed completely without thrombosis. So, vasoconstriction. What happened if you have vasoconstriction? So, you have a reflex vasoconstriction. For example, this is the wound area, no? This is the wound area. So, dito mag-vasoconstrict. Ang purpose ng vasoconstriction is to release, no, mga endothelin, as well as to make the collagen opposed to each other, no? Para magkalapit, no? Kasi it's a form of reflex. Kasi imagine mo may sugat na dito. Okay? Then after that, it will form a primary hemostatic plug, no? By platelet adhesion, no? So this platelets, pupunta ang mga platelets, dadami ang platelet dyan, dadami ang platelets dyan. Pero kailangan maganda ang von Willebrand factor mo kasi didikit sila dyan ang mga platelet na yan. Then, pag mag-adhere na ang mga platelet, they will have to change their shape. No? So they will follow kung kailangan nilang malapad, kailangan silang bilog, depende sa sugat, no? Depende sa trauma. No? Then, once na makapag-stabilize na ang mga platelet, they will release different granules. No? Then, kung makarelease na ng mga granules, the purpose of that is to recruit. No? To recruit. So remember, mga platelet yan. So delikado din pag magsobra ang platelet mo. So that's why may nagkukontrol na hanggang dyan ka lang. Hanggang 4 to 5 layers ka lang. Hanggang 6 to 5 layers ka lang. Or else, magiging thrombosis na yan. No? Then, pag makomplete na yan, there will be a formation of the primary hemostatic plug. No? So, medyo na-sealed na siya. Pero again, this is not strong enough. It needs to go to secondary hemostatic plug. Okay? Secondary hemostatic plug, may fibrin na. No? So aside from that 2 or 3 layers, kailangan mayroon ka pang ilalagay na sealant, no? So fibrin polymerization through thrombin activation. Okay? Then thrombosis na and anti-thrombotic events. So thrombosis is due to the release of your fibrinolysins and thrombomodulin. Kaya medyo mag-i-elevate yan kasi kailangan ng maraming platelets ng thrombus, no? So para maging strong talaga. Then, later on, may darating din dito ng mga antithrombin para maayos na siya, no? Maging flattened na yan. Okay. So, when you say thrombosis, this is inappropriate activation of the hemostatic process in an injured vasculature. Or, this is a formation of thrombus in the setting of relatively minimal vascular injury. So in other words, excess of thrombus formation. Okay? So in relation to that, we have what we call a Virchow's triad. So Virchow's triad consists of three: endothelial injury, hypercoagulability, and abnormal blood flow. Okay? Because any derangement of these three factors can cause thrombosis. And the most important one is endothelial injury. No? Because according to the different proponents, kung walang injury ang endothelium, walang thrombosis. Kasi hindi ka man magkakaroon ng abnormal blood flow and hypercoagulability kung wala kang endothelial injury. So endothelial injury is the most important component of the Virchow's triad. Okay? So what are the different factors predisposing to thrombosis? As I mentioned, coagulability, meaning alteration of the coagulation pathway that predisposes to thrombosis. It can be primary and it can be secondary. So sa primary, we have nothing to do with it because this is genetic. Mayroon talagang mga tao magbilis mag-coagulate. No? This is due to factor 5 gene mutation and mutation of the prothrombin gene. No? So this is the most frequent. So wala tayong magagawa dito. So kasi genetics talaga yan. Are other secondary conditions just like prolonged bed rest, Gaya sa atin, prolonged sitting down due to virtual learning, palagi tayong nakaupo. So prolonged, immobilization can cause thrombosis. So kailangan natin tumayo tayo, kailangan natin mag-action, So obesity, cancer, atrial fibrillation, myocardial infarction, and tissue damage from surgery and burns. They can cause hypercoagulability. Okay? Then abnormalities of blood flow. Turbulence, So ibig sabihin, pag mabilis masyado ang blood flow, it can cause endothelial injury, Or there will be a local area of stasis leading also to disrupt ang laminar flow ng blood. So this can cause thrombosis. Okay? So the thrombus can be venous or arterial in origin. So venous thrombi are usually occlusive, and they are red, and they are long, and they form a cast of vein, and red blood cells alternating with peripheral areas of fibrin. So this is a blood vessel. As you can see here, a thrombus, occupying the lumen of the blood vessel. And this is the gross, the blood vessel filled with thrombi in the lumen. Okay. So what are the fates of the venous thrombi? So what will happen? So first, they may organize, meaning dadami pa yan. Second, they may resolve or mawawala sila. Ang third, medyo nakakatakot, The thrombi can travel from one site of origin to a distal part of circulation, which can cause obstruction at nakakatakot ang thrombi embolization, So this is the microscopic picture, usually an arterial thrombus. So arterial thrombus, mayroon tinatawag na lines of Zahn. So when you say lines of Zahn, this is an alternating pale and dark layers, Dark, pale, light, dark, light, dark. So ang tawag nito ay lines of Zahn. So the lighter, lines are made up of platelets and fibrin, whereas the darker one are made up of red blood cells. Okay? So how will we differentiate arterial from venous thrombi? Usually arterial is this from the site of injury or turbulence. Whereas venous thrombi, they occur at the site of stasis. Whereas arterial is retrograde growth, whereas your venous thrombi is forward growth. And arterial is prone to occlusion. Venous also can be occlusive and fragmentation. Arterial thrombi grossly are gray-white, whereas venous thrombi are red in color. And arterial thrombi, they are more platelet and fibrin, but less RBC. But venous thrombi, more RBC. Okay? Then what are the clinical significance of thrombus? So, syempre, it can cause obstruction. So, kung may obstruction na ang blood vessels mo, it can lead to ischemia. So, ischemia, lack of oxygen na. No? So, kung prolong na ang wala ka ng oxygen, it can cause infarction. So, patay na ang tissue or organ. And thrombus is a source of a thromboemboli, which can lead to the next topic, which is infarction. So, infarction is due to mga ischemia. So, ano ang ischemia uli? So, walang oxygen na makadeliver sa tissue or organ. So, there will be an ischemic necrosis of tissue distal to an area of arterial occlusion or an area of obstructed venous outflow. Okay, there are two types of infarcts, the red and the white. So, based on color, no? Red, or it's also known as hemorrhagic infarct, whereas your white is also known as anemic infarct. The red is due to venous occlusion, whereas the white is due to arterial occlusion. So red infarct are seen in loose tissues, in organs with dual blood supply, just like the lungs, the liver, and seen also in a previously congested organs, no? Just like nutmeg liver, and also seen in a reperfused or tissues. Whereas white or anemic infarcts are seen in solid organs, or for those organs with end arterial supply, in the kidney, spleen, retina, and heart. Okay, so this is a gross picture of an infarction. So this is the red infarct, no, from the lungs. You can see patay na ang tissue na to, infarcted na. And in the spleen, you can have a white infarct. Okay, and this is also a hemorrhagic infarct in the gastrointestinal tract, no? So you can see red. Okay, and a white, no? The kidney infarct, spleen. So we have splenic infarct here, the whites. These are the viable, no, the viable parts of the organ, whereas this is representative of infarcted part of the organ or the spleen. Okay. Then this is the heart, no? So this is the myocardial infarction. So the pink one are the viable cardiac myocytes, whereas the white ones are the infarcted. So itong hitsura, no? If you have a myocardial infarction. So wala nang oxygen na nakapunta sa blood, for a long time namatay ang ibang mga cardiac muscles. So this is what you will see in a myocardial infarction. Okay? And this is also the renal infarct. No? So you can still see the tubules, no? But compared to the middle one, medyo viable pa, pero ito mga infarcted na. So parang mga ghost na lang sila. Pero mga patay na ito, infarcted na to. Okay? Then embolism. What is embolism? Emboli. So when you say embolism, this is a process by which a detached intravascular solid, liquid, or gas material is carried via bloodstream to a site distant to the point of origin. So one solid material here or liquid here, it will be thrown out to the different parts of the body or distant to that organ. Okay? So what are the types of embolism? So the embolism can be thromboembolism, meaning thrombus, no, na napunta sa ibang lugar. So imagine mo ang thrombus pumunta sa brain. O di syempre, stroke ang pasyente or death, no? Or systemic embolism, no? Dadaan ng heart, then it will go to the different organs. You can have also amniotic embolism, air embolism, fat or cholesterol embolism. Okay? So this is a short diagrammatic formation of a pulmonary emboli. No? So usually a pulmonary emboli from the leg veins, no? Thrombosis. No? Pag nagka-thrombose ang mga paa natin, so there will be formation of thrombus. Ang danger niyan kung pumunta sa lungs. No? Kung pumunta sa lungs ang thrombus na yan. So gaya nito, no? Okay, so that's the thrombus going up to the lungs, then patay kaagad ang pasyente. No? So that's pulmonary thromboembolism or PTE. So yung sabi ko kanina, is usually from the veins of the leg, no? 95% from the deep veins of the leg. Majority lodges at the large and the medium-sized pulmonary artery. So, ang iba direksyon na mamatay, ang iba medyo comatose, no? And this is associated with immobilization, surgery, cardiac disease, and cancers. Okay? So, anong hitsura ng pulmonary thromboembolism, no? So, it's nothing else but a thrombus, no, napunta doon sa lungs. So it can cause hemorrhagic infarction of the lungs. Another one is, here is a blood vessel, a dilated blood vessel, and filled with this emboli. What type of emboli? No? As you can see here, these are bone marrow, no, emboli. This is from yung nagsi-CPR, no? Iba pag nagsi-CPR, rib cage, no? The rib cage. So pwedeng mag-emboli ang mga bone marrow from the bones in the ribs going to the different parts of the body. No? Another is, this is a pregnant woman, no, after the postpartum, no? So this is called amniotic embolization. Okay, then we have what we call paradoxical emboli. So when you say paradoxical emboli, this is emboli which travels from venous to arterial circulation, no, via a communication between arterial and venous circulation. It's called paradoxical. Whereas systemic emboli, these are emboli traveling within arterial circulation. So 80% from mural thrombus from the left ventricle from acute myocardial infarction or from right atrium from rheumatic heart disease. Others from aortic aneurysm and 10% unknown. Okay? And the size of enlargement of the systemic emboli, 75% to the lower extremities and 10% to the brain. Others into the viscera and upper extremities. Okay? And take note for systemic emboli, they're almost always occlusive and therefore produce infarction. Okay? Then we have to the short slide about DIC. So DIC is disseminated intravascular coagulation. So this is the sudden onset of fibrin thrombi in the microcirculation with the consumption of coagulation factors and formation of fibrin degradation products. So the blood vessels now are filled with many fibrins. So this is a potential complication of any disease process associated with widespread activation of thrombin. So this is a systematic, this is not a single, no, this is process, but a combination and as a part of the complication of any disease process. And last is the shock. Now, of course, you cannot see shock microscopically, but this is a situation in which the circulatory system can no longer supply nutrients and oxygen to the peripheral tissues. So na-shock ang mga tissues or organ. No? So the causes are shocks also. So it can be septic, no? If you have a severe inflammation, if you have hypovolemia or severe blood loss or any obstructive condition, if you have a cardiac problem, an anaphylactic reaction, a K, and spinal or neurogenic shock. So the causes of shocks are also shocks. Okay? Any questions? Clarifications? I just summarized my lecture. So for your details, please read your book. Please read Robin's Pathologic Basis of Disease for details. No? So just follow the outline and the details. So I discussed here the important ones. Any clarifications, guys? We still have 10 minutes before the time. Clear? Okay, klaro man, ano? So, I have task for you to do, no? So you will be grouped. The groupings will be the same in the laboratory, no? So we have group 1, 2, 3, 4, and 5. Okay. So the first group, the first group under me. Okay. So please explain the following. No? So sino ang group 1? Okay, you have this one. So give me the reasons why, no? So for example, blushing of face after exercising or being feverish. So bakit bakit may blushing? So please explain that. So group 2. So bakit may hemoptysis in a 50-year-old male with PTB? So hemoptysis is a form of hemorrhage, no? So a 50-year-old male with pulmonary tuberculosis. And bakit may thrombosis in chronic leukemia? And bakit may hemorrhage in post-trauma? Okay, group 3. Please explain to me the following. And group, wala palang 4. Hala. 4 ito, ha? Sorry, hindi 5. Group 4, under Dr. Trinchera, these are the conditions. That's group 4. Then group 5. So, bakit ang prolonged immobilization can produce to thrombosis? No? Bakit be presented next Thursday? So that I will give you time for your presentation, for your preparation. Okay?
Hello po, Doc.
Yes?
Nag-copy ka po, Doc, nung binigay mo yung instructions.
Sorry. So I will repeat. Yeah, okay na?
Okay na po.
Okay na. Okay. So each group will have to prepare to answer. Okay. Your answers will be placed in a PowerPoint presentation. So whatever will be your it depends upon the group, no? On how will you do it. For as long as you can convince me the explanation why. No? So bakit may not, for example, bakit may nutmeg appearance of liver in the right-sided heart failure? No, and so on and so on. Okay? So since there are 3 conditions per group. So you can divide the members of the group, for example, 10. So the first condition, dalawa ang magpipresent or tatlo. So ang importante dito, lahat involved, no? Hindi lang isa ang magpipresent. Bahala na kayo sa pag-divide sa group members for as long as lahat involved in the presentation. Okay? So the presentation will be on the format is PowerPoint, and this will be presented next Thursday. So I will give you time tomorrow. So we will have no, I'm done with my lecture. So you are free tomorrow. So you can prepare this to answer and later on to present. Okay. So the presentation time will be on Thursday at 9:30 to 10:30 a.m. Okay. So again, everybody must be involved in the group. Okay. So the shorter, the better. No? Just convince me ano ang explanation ng condition na yan. Okay? So any clarification before we end?
Excuse me pa, Doc. Pwede po pabalik sa group 2?
Group 2, okay. Wala group 4, sorry ha. Ang group 5 is 4 yan. Ang group 6 is group 5 yan. Okay, group 2 ito.
Thank you pa, Doc.
Okay na ang ibang groups. So just
group 1 po, Doc.
Group 1, oh. So DVT traveling in an airplane for a long period of time predisposes to deep vein thrombosis. So ibig sabihin matagal tayong nakaupo sa plane, no? So if you have an international flight of more than 24 hours, talagang nakaupo ka lang, no? So siguro mayroon kang transfer lang ng 1 to 2 hours, 2 to 3 hours, but again, another prolonged sitting na naman. So bakit nagpe-predispose yan to thrombosis? No? So just explain to us. No? Any more clarification? We have 3 minutes. Contest daw, no? Ang magandang group ang presentation, may prize. Ano? Practice, no? Practice na. This is a group activity. Then, kailangan magandang explanation, syempre, or answers ninyo in relation to our lecture for today. No? So, I think it's very clear. So, I would like to thank you for your attention and listening to the lecture for this morning. Okay, sandali, baka may chat. Doc, may time allowed lang po. For the presentation, okay. So, since there are 5 groups, so pwedeng 10 minutes per group? Kaya? Kaya man, di ba? We have 5 groups. Mga 1 hour yan. So, 10 minutes per group. Wala na? Okay, so thank you very much. So, Miss Joanne, please take in charge with the attendance, please. Thank you. Bye-bye.
Thank you, Doc.
Thank you, Doc.
Thank you po,
Thank you,
Doc.
Doc.
Yes, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc. Your person.
Thank you, Doc.
Your person, Doc. Your person.
End ko na guys. Bye-bye.
Yo! Char lang.